Good evening, everybody. Happy Friday evening. I pray we're all healthy, clean, and virus-free. I'm going to touch on vaccines tonight and also immunoglobulins that build up in our system if we were positive for SARS-CoV-2, the virus. Multiple vaccines are being worked on. Two particular ones that have come far along are both actually vaccines that recognize the genetic material of SARS-CoV-2 as opposed to other studies or other vaccines that are being investigated or researched or developed or in development that are recognizing and trying to attack the spike protein that's coming out of the virus. Keep watching the media. You'll hear conflicting stories about whether or not we're going to have a vaccine in December, January. The take home here, though, is no one knows. Okay? No matter what you're hearing out there, of course, everyone wants to be optimistic. I'm optimistic about it. I'm hoping, the sooner the better. The sooner a safe, effective vaccine is out, the better for everyone, for the world. If one comes out by December, it would be incredible that a vaccine was developed, a safe vaccine was developed that quickly. Right. When a vaccine is used, administered, it causes your immune system to create antibodies against the substance in the vaccine that is identical or similar to the intended potential future target. What I mean by that is every year most of us get a flu vaccine or a vaccine against influenza, which is a virus. Once we get exposed to the flu, because we had antibodies built up that fought the vaccine, now those antibodies see something similar to that vaccine, i.e. the influenza virus, and immediately attack it because we have those antibodies already built up in our system because of the vaccination. Something similar happens when we have been exposed to SARS-CoV-2. Again, not the vaccine, but actually the virus itself. If we are exposed to it, in other words, if the virus is in our system, antibodies begin to build up. And the reason why we may be ill at first and then recover is not because the virus has gone away on its own, but because our immune system fought it, destroyed the virus, killed the virus, if you will, and we recovered. Once you're exposed and you recover, or once you're exposed and you wanted to know if you had been exposed to the virus, within the first couple of weeks of having the exposure or having the virus, your immune system develops a specific type of immunoglobulin called IgM. IgM is the first antibody that is created by the immune system. If you are positive if you were tested and you were shown to be positive for IgM, that would mean that you were exposed to the virus within the last couple of weeks. After 2 to 3 weeks, your immune system creates another antibody to fight the virus. And this second antibody, or immunoglobulin, lasts longer in the system than IgM. And this immunoglobulin is called IgG. Okay? So if you had an antibody test and you tested for IgG, and IgG was positive, that would mean that you were exposed to the virus more than 3 weeks ago. We don't know how long IgG stays in the system. We don't know the extent of protection it offers if you have that antibody. We do know that it is possible that if you do have that antibody, that there is a certain amount of resistance to getting the infection again. But again, we do not know the strength of that protection. We don't know the length of that protection. 3 weeks, 3 months, 3 years. So, vaccines being worked on, many vaccines. Antibody testing is available. Previously, a couple weeks ago, I recommended that we use caution about getting antibody testing only because the FDA allowed a lot of tests to hit the market that were not approved because of the urgency that was felt to get people tested. Since that, the FDA has now approved a few tests. So if you get antibody tested, and it's not done in my office, it's done outside my office. In my office, we have FDA approved antibody testing. If you're getting antibody tested outside my office, in an outside lab, you want to ask, you want to be, again, you want to be smart. That's what this is all about, these videos, just making you more intelligent on what's going on. You want to ask, is your test FDA approved? And if the answer is no, don't get that test. If the answer is yes, then I would go forward with it. Knowing that if you test positive for IgM, that means you were exposed to the virus within the last 2 to 3 weeks. If you are positive for IgG, that means you were exposed to the virus 3 weeks ago or further. Vaccines are coming, hopefully. Safe and effective, we hope. Antibody testing is not a bad idea. Getting tested in my area right now for the infection itself, in other words, the nasal swab, is still not recommended to be done unless you have symptoms. Most nasal swabs that are out there are still no more than 60 to 70% effective. Again, the nasal swab tests whether or not you have an active viral infection. The antibody testing, which is a blood test, serology test, tests whether you had been exposed to the virus in the past. 2 different tests. It's Friday evening. I want to add one particular thing once again as I look at the media, TV, news channels, social media. Whatever I put out on this evening video, Monday through Friday that I'm in the office. I'm not going to add anything political to it. At the end of all this, I hope you never know whether I'm a Democrat or a Republican or any other political affiliation, because that's not what this is about. This is about me trying to get information to you, just you, that's pure, honest, and without any agenda. It's confusing if you watch the media. I get confused watching the media. Even if the information is correct, it's twisted to fit some sort of agenda for that news station. I've seen quotes from Dr. Fauci not be, the quote was correct, except they didn't use the rest of the words in the quote, so it made it look different. I want you to get your medical advice from a primary care physician, from your primary care physician. I don't want you, I would rather you do not get medical advice that you're going to follow from somebody who did not go to medical school. It doesn't mean you can't be intelligent about medicines if you didn't, but really, physicians not only have gone to school for this and not only in practice for this, but getting medical advice that you're going to follow would be best from a physician that you have a relationship with. I pray all of you are safe this weekend. I pray that you all use your judgment. Be smarter than politicians. Be smarter than the news. And just know that this makes sense. Facial coverings stop viruses from leaving your mouth. Facial coverings, social distancing, and a lot of soap and water stop this virus from spreading. There's no politics about it. That it's just fact. It's just fact. Have a wonderful weekend, everybody. I look forward to talking to you again on Monday. Good night.